almost a year to the day that Imperial College London warned that 250,000 people could die from coronavirus.
Despite this, it took the government another week to bring in the first national lockdown, and critics say poor decision-making in the first 3 months shaped the rest of 2020.
I'm shaking hands continuously. I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody. You'll be pleased to know, and I continue to shake hands.
And it's important to recognise it's not to stop everybody getting it. You can't do that. It's not possible to stop everybody getting it, and it's also actually not desirable because you want some immunity in the population.
If we can get this down to numbers 20,000 and below, that's a good outcome in terms of where we would hope to get to with this outbreak, but I mean, it's still horrible.
Though we still do some contact tracing and testing, for example, in high-risk areas like prisons or care homes, that is not an appropriate mechanism as we go forward.
I'm glad we've been able to protect the majority of homes, and we'll keep working to strengthen the protective ring that we've cast around all our care homes.
We can turn the tide within the next 12 weeks, and I'm absolutely confident that we can send a coronavirus packing in this country.
Well, joining us now to discuss this is Deputy Editor of the Sunday Times Insight Team, George Arbuthnot, whose new book, Failures of State, the inside story of Britain's battle with coronavirus, examines the government's handling of the pandemic, and former Conservative MP and author Edwina Currie as well. Thank you both for joining us this morning. George, hindsight is an extraordinary thing. We've heard the word unprecedented on a number of occasions across the last year, certainly. And of course, looking back, we can see reasons and behaviours that the government implemented that didn't help us. But considering your book and considering how you've gone through it in forensic detail, how do the government come out with regards to their handling of the pandemic?
The book exposes one of the most scandalous failures of political leadership in British history. We started the year with being ranked with the world's second best pandemic plans, but we've ended up with Europe's worst death toll, one of the world's worst recessions. And we've spoken to hundreds of inside sources, including politicians, scientists, epidemiologists and doctors, to try to understand how that happened. And what's absolutely crystal clear is that the single most important reason that outcome happened is because of Boris Johnson's three late lockdowns. On 3 occasions, he was advised to act swiftly and decisively, and all 3 occasions he dividend delayed and allowed hundreds of thousands of unnecessary deaths, and a longer, more economically ruinous lockdowns had to then be imposed to bring the skyrocketing infections back under control. So we've spoken to the government's own sage scientists who say that making that mistake once is bad enough, but to make the same mistake 3 times is unforgivable. And that's why it's so critical that we reflect and try to learn the lessons of what's gone wrong and make sure it never ever happens again.
Edwina Currie, I mean, that description, one of the most scandalous failures of political leadership, you know, that's something that this government has to carry. When you look back at what went wrong right from the start, the Prime Minister missing Cobra meetings where they were discussing this emergent threat, his failure to shut down mass gatherings and saying that they weren't particular risk, his insistence that he was carrying on shaking hands even where there might be people with COVID, the failure to test, track and trace, the failure over PPE, which left, well, you know, you're saying, you know, and on it goes. The trouble is, it goes on and on and on.
Susanna, if you're not peers, so give me a chance. George has a book to sell. It's coming out tomorrow.
Sorry, it has nothing to do, Edwina Currie, it has nothing to do with whether I'm peers or not. These are facts which meant that we have this devastating death toll. And my question is, which was the biggest mistake and what should they have done better?
Let me respond. Thank you very much indeed. Right, look, this time last year, absolutely nobody in this country or in most other countries had any experience of anything like this. If you're a government minister, and as I've been a Minister of Health, You rely heavily on the experts who are advising you. You don't try and counter-argue with them. And they rely on information, which at that time was very scrappy. What was coming out of China was very limited. We hadn't realised at all. We didn't realise till many months later that, in fact, we were being infected from Spain, from Italy, from France, that people coming back from half-term holidays when they'd gone skiing were bringing the infection back. It was already too late to stop that. There was a football match, a big Champions League football match on in Liverpool exactly a year ago today, with thousands of fans coming in from Spain, bringing the infection with them. We had no idea. We had no idea it was so infectious. We had no idea it was so lethal. We did our best. The Prime Minister shook hands as a reflection of what Diana did during the HIV problems. Do you remember those? When Diana went into the hospitals in order to shake hands with patients and to say to them, you are not being stigmatized. That, I think, is what he was doing.
It was a complete misunderstanding of what COVID was and how it was transmitted. George Arbuthnot, is it fair to say, George Arbuthnot, is it fair to say this is down to a failure of information at that stage, that nobody had any experience of anything like this, and the scientists didn't inform the government properly?
The scientists were clear from January that the coronavirus was more infectious than the Spanish flu, which caused more than 100 million deaths. I mean, you couldn't have been clearer. And I mean, just to list some of the decisions that were taken, and your viewers can decide whether or not these were decisions that they would have taken if they were in the Prime Minister's position. In the beginning of February, he dismissed efforts to curtail the virus as an irrational panic. He missed the first 5 COBRA meetings on the virus, despite being in Westminster for 4 of them. He donated, or his government donated, hundreds of thousands of pieces of our PPE to China just weeks before our own NHS began to die because they didn't have enough. They pursued a disastrous herd immunity policy at the beginning of March, despite being warned by their own scientists that would lead to more than 200,000 deaths.
Edwina, can we come back to you on some of those points? I think one of the points that George made at the start as well, of course, when this started, the government trying to get up to speed and work out what the plan was going to be. So they were late with that first lockdown. But the second couple of lockdowns, we had experience at that point. We had understanding of what was going to happen. And clearly, they were being informed by the scientists that we needed to lock down sooner, and yet they still delayed those lockdowns.
Well, because you've also got to balance with that the problems that you're going to have to the economy and to the thousands of jobs, the mental illness that causes, the other illnesses that causes, the failure to look after other people. I mean, my husband died of cancer during last year. Many people needed to be treated and needed to have all their screening and so on. There are other things that have to be balanced. There's never just one issue that governments have to make a choice about, and ministers are always going to have to make those kind of choices.
So, Edwina, do you think there's anything that you would hold the government accountable for? Because you're cutting them a lot of slack, and we totally respect that because you've been there, you've been frontline in politics, so you understand, have an insight into how these things work. But what is it? Is there anything that you think they have got wrong?
Well, if I'm absolutely sure of one thing. If George, nice man and clever journalist that he is, if he'd been in that driving seat, he'd have probably made exactly the same mistakes at exactly the same time, because he would have had exactly the same information that those who were advising us and taking decisions on our behalf did. I think also we should also put in this balance: the millions, the billions and the choices made about supporting the vaccine programme, getting it up to scratch, getting it working very fast. Today, at lunchtime, the 25th million, no, let me get that right, 25 million person in the UK will get vaccinated against COVID. We are well ahead of where everybody expected. How about that for beating expectations?
Yes, well, I think there is absolutely no dispute within the UK, certainly, that the vaccination programme is one of the successes. And we have never held back from congratulating those in charge for making that happen. George Arbuthnot, thank you very much indeed. And Edwina Currie, thank you for joining us. And, our thoughts with you, because obviously last year that must have been a very, very terrible time. And so, and huge commiserations to you for your loss. Thank you for being with us.
Sorry, Susanna. I just want, if George is still there, I want to put him on the spot a little bit. Rather than looking back, looking forward, we currently have an R rate which is higher, 9 times higher than we had at the end of the second lockdown. Do you think we're coming out of this lockdown too soon? And what would you do now?
I think we need to be incredibly cautious. And if you look at the decision making around the 3 lockdowns, it's actually got worse rather than better. You know, Boris Johnson has actually failed to learn the lessons. If you look at the first lockdown in March, there were 7,000 COVID patients in hospital. At the second lockdown, he'd actually allowed that number to double to 14,000. And by the third lockdown in January, there were 30,000 people in hospital. So, you know, remarkably, like the virus, his dividend delay was actually growing exponentially. And what's scary is that if we had another mutant strain that happened to circumnavigate the vaccines, what would he do then? Would he learn the lessons and finally bring in a faster lockdown? You know, so that's something that we need an inquiry to make sure that those lessons are learned.